Hi, everyone, and welcome to Hi-Fi Health News. I'm Erica Grotto. Pushback on healthcare provisions in the One Big Beautiful Bill Act could mean some don't go forward as planned. Lawmakers and others are now working toward rolling back those provisions, and time will tell whether they're successful. Joining me now is Rich Daly, a senior editor at the Healthcare Financial Management Association. Rich, let's set the stage quickly. What are the changes to Medicaid laid out in the bill?
The Medicaid changes are aimed mainly at either the states or at tightening eligibility. So, for people on Medicaid or whatever your state may call the program, they have different names like Medi-Cal in California. The big change is a new requirement to either work or to go to school or even volunteer part time each month. They could also have more paperwork requirements to prove they're eligible and have to do that twice or even more a year. And so overall, it's going to be more work to either get on or to stay on the program.
Pushback on the healthcare provisions of the bill were introduced pretty much as soon as the bill was signed. What's happening there?
Right. Several bills were introduced in the immediate aftermath of the July 4th signing of the bill into law. And those new bills would roll back several of the provisions within the new law. For instance, one of them is a bill from Senator Josh Hawley. He's a Republican from Missouri. His bill would eliminate a couple of the law's big provisions that focus on the way that states get federal matching money and how much they can get from healthcare providers to help cover their costs. One other provision of his bill would double a $50 billion rural fund for providers.
Some of these provisions aren't scheduled to go into effect until 2027, 2028. That provides a lot of time to make changes. What are some of those provisions?
Sure. The big one is on January 1st of 2027. That's when the work requirements go into effect. However, states can ask that those be delayed for up to 2 years if the federal government agrees. The next big policy that's going to go into effect is just before the upcoming presidential election on October 1st. People on Medicaid will have to start paying copays when they go and seek non emergency services from most providers. One other provision that goes into effect ahead of the election is the end of so-called passive enrollment on the ACA marketplaces. So what that means in real life is if if you or your family are now getting coverage through the ACA marketplaces, you're no longer going to be automatically re-enrolled every year. So every fall and winter, if you're getting coverage there, you're going to have to now take action and submit paperwork to either prove you're eligible for coverage or to get the subsidies that are available there. So overall, it's going to be some more work and some money for those that get public health care benefits.
So, since you brought up the presidential election in 2028, 2029, we will have a new presidential administration. Do you see that affecting any changes to anything that's happening right now?
Yeah, the change in administration will probably ultimately be needed to sign into law any major changes to this new law. That's because health policy watchers I've talked to agree that President Trump is unlikely to sign into law any bills changing any major provisions while he's president. It's because his reputation or his priorities are really staked out in this law, and any major changes would be seen by him as undermining that. So any change that gets through Congress may end up being vetoed until there's a new president who's willing to sign those changes into law.
That's it for us today. I'm Erica Grotto for Hi-Fi Health News. Thanks for watching.